You know, when a world leader's health becomes news, it's never just a personal story. It can touch on national security, on political stability, and that's exactly why this recent announcement about Israeli Prime Minister Benjamin Netanyahu is so fascinating. We're going to dig into the medical journey for sure, but also the very deliberate political timing of the reveal.
It all kicked off with this really simple, almost blunt admission from the Prime Minister himself. I had a problem. But this wasn't some sudden, dramatic crisis. Nope. The story actually starts months earlier with something most of us can relate to.
So, picture this. It all begins during a completely normal, routine annual checkup. But this one appointment would start a chain of events that was kept under wraps for months, for some very strategic reasons that we're about to get into.
And this is really where everything changes. That standard screening, it turned up something that, well, you just can't ignore. A health issue that required immediate attention, and a really critical decision from the Prime Minister.
Okay, so let's jump right to the big reveal. When the Prime Minister's office finally put out the report, the headline news was, actually, it was overwhelmingly positive.
The official report laid it all out. At 76 years old, the Prime Minister had been treated for early-stage prostate cancer. The bottom line? The tumor was gone, there's no trace of cancer left, and his doctors say he's in excellent physical condition. So a total success, right? But to really understand the full story, we have to rewind a little and see how they even got to this point.
All right, to really get the full picture here, we got to rewind the clock a bit, because this wasn't just some sudden bolt from the blue. It was actually the result of some very careful and consistent medical follow-up.
Now, what's really fascinating about this timeline is how it shows just how crucial that follow-up care is. See, back in 2024, Netanyahu had surgery for a totally non-cancerous issue, but because of that, he started a series of regular checkups, and it was during one of those routine screenings in early 2026 that doctors spotted something, an abnormality.
So tests confirmed it was a tumor, and here's the key word, malignant. Now, if you're not familiar, malignant is just the medical way of saying cancerous. It basically means it's the kind of thing that can grow and spread if you don't deal with it, which made the next decision incredibly important.
Okay, so this put the Prime Minister and his doctors at a crossroads. They had two basic options. One, they could just watch it, keep it under observation, monitor its growth. Or two, they could act and act immediately to get it removed. Netanyahu chose to act.
And this is the path they went down. As soon as that malignancy was confirmed, they decided to move and move fast. He had a radiation-based procedure, and it worked. The tumor was completely removed, which brings us back to that clean bill of health.
Okay, and here's where the whole thing gets, well, complicated. We're moving from a personal health story into the world of political strategy. The medical side was a clear success, but the timing of when they told everyone, that raised a whole different set of questions.
And this really is the million-dollar question, right? The treatment was a success, the cancer was gone, the Prime Minister was healthy, so why the delay? Why wait to release his annual medical report and share this news with the Israeli public and with the world?
And we're not talking about a small delay here. It wasn't just a few days or a week. We're talking 2 full months that the publication of his medical report was pushed back. That's a pretty significant amount of time, especially with everything going on in the world. So, what was the reason?
Well, Netanyahu actually addressed this head-on, saying he was the one who asked for the delay. His reason? He said he did not want the information released during the peak of the conflict with Iran because he was worried it would be used to spread more false propaganda against Israel. And this really gets to the heart of it, doesn't it? For any world leader, especially in a region as tense as the Middle East, you always have to project strength. A health problem, even one that's totally fixed, can look like weakness to your enemies, and they could use it to try and stir up trouble. But it wasn't all about politics. Once the announcement was made, the Prime Minister also used it as a moment to share a bigger, more universal message, one that had nothing to do with geopolitics and everything to do with personal health.
First, he made sure to thank the medical team at Hadassah Hospital who took care of him. But then he shifted his focus to the public. He basically turned his own experience into a call to action, urging everyone to take their health seriously, to get those regular screenings, and maybe most importantly, to listen to their doctor's advice.
So when you step back and look at this whole story, it's way more than just a medical bulletin. It's this fascinating case study of where personal health, political gamesmanship, and national security all collide. A successful treatment, kept secret for strategic reasons, and then finally revealed with a public health message. And it leaves us with this really big question to think about. When it comes to the people leading our countries, where do we draw the line between the public's right to know and their right to a private